Hello, this is podcast number 47. I'm Susan Clinton, and this is Tough to Treat. Summer days are just around the corner in the Pittsburgh area, and this podcast is featuring a young lady who, in an effort to get back to activity and movement, ended up with some low back pain and the need to constantly stretch. So this is a tried and true theme that we've had before on this podcast. I hope you enjoy it, and we look forward to your feedback. Thank you very much. Hello, everybody. This is Susan Clinton and my partner, Erica Meloe, and we are Tough to Treat. Hi, Erica.
Hi, Susan.
How are you?
Good.
Yeah, I am going to talk today about something that we have covered in the past, but bears worth repeating. This one was a little bit different than what we've covered in the past because there's a lot more fear avoidance behavior going on with this person. But basically it's the story of a young lady with back pain that's becoming persistent and the need to stretch. So we've done this a couple of times and talked about this, that sometimes when there's an irritable segment, the patterning that takes place around it, gives them this feeling that they just want to keep stretching and stretching and stretching their back, but to no avail. So I'm just going to go ahead and set it up and dive right in.
Sounds good.
Okay. So this is a young lady that is in her 20s that was referred to me from her family. I've been treating several of her family members as well. Then she's came in complaining of 5 months of left low back pain and left glute pain. And she said that it started when she felt this knot in her back. She rubbed this knot or felt this knot in her back. And she said, the knot really worries me. And, I've had back pain kind of ever since, and I feel like I'm trying to need to stretch it all the time, and I can't really figure out how to stretch it, so I'm coming here to find out what I can do to make this feel better, like what stretches can I do, and how can I get this knot to resolve. So she kind of gave me a little bit of a story. Her past history, she's had some basal cell skin cancer, has had some treatment for that, and she's also had treatment for neck and shoulder issues in the past that happened. She said it kind of happened in insidious onset, but just she felt like it's probably from my position at the computer, and I just felt like I was weak there. So I had therapy there, and I felt, so I feel a little bit stronger, but I have to constantly watch what I'm doing with my head and shoulders. Okay, and so she has a desk job. And so I said, well, what, tell me the story here. So this is May, and she said it's been going on for 5 months. So in January, she started a yoga practice. And because she said, I wanted to just move more and, and I thought this will be really good for me. So she said that she went to this power style yoga heated studio and started doing the practice. And then she said that, she says, I don't know if I did something when I was in yoga or not. And I said, well, can you remember anything that might have happened? She goes, no, not really. But she said, what I have done since is I've switched up and found a different yoga studio. And she goes, it seems to suit me a little bit better. And I said, okay, that's good. But she said that she started having left hip joint pain about 2 weeks ago. So now the back pain and the left glute pain is kind of starting to spread around to the front of her left hip a little bit.
Got it.
So we kind of have that going on as a history. So I kind of asked her to explain a little bit about what her back pain felt like and what was really worrying her about, this knot and these things. And most of the time that she's sitting there, she's pretty squirming in the chair. She's sitting up, she's sitting back, she's sitting to the side, she's doing this. She's an animated talker too. So some of it could be just a little personality driven, but she seemed like she might be a bit uncomfortable sitting there. So she told me, she said, well, my neck and shoulder thing turned into this widespread pain event, and it started off with a knot in my shoulder. So I'm worried to death. A knot Yeah,
Yeah.
KNOT, not.
Yep.
I'm
Yep.
worried to death that this is going to turn into the same type of event that my neck had.
She said worried to death. She used those words.
Use those words.
Okay.
Worried, 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 like worried to
Okay.
death. This is what's going to happen.
Okay.
Okay. So, I reflected that back with her, and, so she knew that I heard her, because I wanted to be sure that she understood that I heard her loud and clear on that one.
Yep.
And then she goes, I'm a chronic leg crosser, left over right. And I try to make myself uncross my legs, and I try to sit up nice and tall. And it seems like I still have this need to stretch. So I know I shouldn't slump. So I'm making myself sit up nice and tall. And I said, well, how do you feel when you sit up nice and tall? She goes, I feel that tightness, like I need to stretch, or I need to just sit back and cross my legs. So we talked a little bit about patterning, and how that happens, and put your hands together, interlace your fingers. We all have one way we like to do it. And she said, well, I tried to cross my right leg over my left. That doesn't feel right. And I said, well, cross your hands together. Yeah, that, I said, now do it the other way, where the other thumb's on top. And it's like, ooh, and I said, none of us like that, so we do have some patterns that are kind of ingrained across diagonals in our body. So
great idea.
That totally makes sense to me, why you wouldn't want to, sit there with your right leg crossed over your left. And I said, do you feel badly when you cross your left leg over your right? Well, no, it doesn't really bother me. I just don't think I should do it. And I was like, well, why do you think you shouldn't do that? And she said, because I've been told to sit up straight. And I said, okay.
Oh,
but
boy.
if you feel comfortable with your leg crossed, can you sit some of the time that way? Would that be a big thing? Well, as long as it's not hurting my back. And I said, but are you having issues when you sit like that? No, not really. It's like, okay, well then maybe you could choose a few different sitting positions so that you have a choice and you're not trying to hold yourself into one position all the time. Would that be reasonable? And she kind of, halfway nodded her head listening, and I still, we'll talk more about that as we go on. She said that she does get up from her desk definitely by every hour. And she said, I just don't like to sit still. I get distracted. I'd rather get up and do things and then come back and do the work. So she's already doing some good habits around this.
So does sitting bother her, or
she said that she doesn't, she always feels like she needs to stretch when she's sitting like that.
Okay, but standing and walking are okay for her. Yeah,
okay. It seems to be fine, except that when her hip started to hurt.
Got it.
And then when her hip started to hurt, she felt like that she couldn't walk the way that she wanted to. And previously to her hip starting to hurt 2 weeks ago, she was walking 2 miles a day, a mile to work and a mile home.
Got it. Okay.
And she had kind of stopped that because her hip was hurting. And then she tells me, she goes, but this is what I did. I took a pillow and put it between my knees at night. And so my hip pain is really getting better. In fact, it's starting to feel pretty good. And I said, that's fantastic. Smart. Great idea. I'm glad it worked. And she goes, so my hip doesn't concern me nearly as much as this stuff going on in my back. So she really wanted to focus on the back, not the hip. That she felt like the hip was just kind of this small thing and she could change it and life was good there. But the back thing she thinks is going to turn into the neck, the way the neck thing turned out a couple of years ago when she had this big pain experience in her neck.
Yeah. It just kills me that people, sit up straight, and they actually take it literally. And I've had so many patients sit themselves straight up into back pain. It's these outdated paradigms that I mean, not just our profession, but everybody. You need to sit up straight. Like,
don't bend your back. Don't twist. Sit up straight. Never slump.
I know. I like to slump personally.
It's like slumping is the new chocolate.
I know.
It's okay to slump a little bit. It's really good. In fact, you probably should. We're not designed to be in one position holding it for long periods of time. We're designed to move. So anyway, so we've got somebody who is now going to start returning to her walking a little bit now that her hip is feeling better. So she's happy about that. She does get up and move at work appropriately and changes positions and does things, but she really is kind of locked into this sitting up straight thing that goes on and not crossing her leg. So, she was saying that I think crossing my leg has made my back stiffer on that left side. And I said, well, explain that to me so I can follow what you're thinking here. And she said, I feel like that my left hip, my left back doesn't move as well. So I think I'm aggravating it by crossing my leg. And I said, well, let's take a look at this and see, when we look at your hip, let's take in your back, let's take a look at that and let's see if you're really truly stiffer on that side or not.
Mm-hmm.
You know?
Yeah, exactly.
So I said, let's go ahead and get moving here. So she stood up and then she looked at me and she said, oh, by the way, when I sit on the floor in yoga, it really bothers me too. And I said, well, have you ever sat up on some blankets or a block? And she said, well, in the one class, no, because nobody did. But she goes, in this new class that I'm in, and then she looked at me and she goes, do you think that'll help? And I said, well, you know what? You brought it up. Let's just do it right now. Mm-hmm. So we grabbed a yoga block. She sat on that, felt pretty comfortable because she could open her hips out and it just made it easier for her back to move.
Interesting.
Then I said, if you want to scale it down, let's try 3 blankets or 2 blankets and fold them up.
Yep.
So we did that. She liked the block a little bit better, so she was good with the block. And I said, okay, good. Problem number 1 solved.
Right.
When you're in yoga and you're going to be doing some floor work, whether your legs are out straight or bent or crossed, let's use those blocks. Those things are there for a reason to really help us, figure out where our movement feels good and where our movement feels like it's being challenged a bit. And the block can bring the floor up to us, which is nice. Mm-hmm. So we don't have to always bend ourselves into positions that may not feel quite so wonderful right at this time. And I said, will it be forever? Probably not. As soon as you feel like you can start turning the block on its side so it can lay a little flatter and you can sit down a little lower, go for it. You have to kind of just watch this feeling that you get, in your back there. So then we stood up. And I basically had her do a bend over because I wanted to see what happened. Which way did she go? What did she do? And then she came back up and we did that a couple of times. And I said, how does that feel? And she goes, that doesn't bother me at all. Not one bit. I said, that's great. Love it. Okay. Yep. Super. I said, so with you just standing here like you are now, tell me what's happening. Well, I kind of am starting to get that feeling in my back again. And I said, okay, so just do a little dive through your body for me and just tell me what's part of your foot you're standing on, feet you're standing on, what's happening there. Mm-hmm. And she said, well, it's interesting because I'm standing on my right leg on the outside of my right foot. Mm-hmm. And I said, why do you think you're doing that? And she goes, probably because I wanted to shift off and get off my back. Get away from that left side. And I said, that's fair enough. Yep. But I said, how do you feel right now as you're standing like this before you make any changes? She goes, well, my back is bothering me a little bit. And I said, okay, why don't let's just try this. Even your feet out on the floor, to where your feet feel the same, like you're standing on the same parts of your foot. Mm-hmm. And just kind of even that up. And so she did. And I said, just give it a minute. Let's see how things are going. She goes, my back doesn't bother me.
Interesting. So she did the forward bends, no problem. And then after she stood up and, 30 seconds later, whatever, I started to bother her. Mm-hmm. Interesting. Okay. She shifted over to the right leg. And then she went back to her left leg and she went back to even. And so standing on the outside of her right foot is left side bending. Correct.
Flexion feels better. Left side bending doesn't feel so hot. Mm-hmm. Right side bending is fine. We did that. I just had her put her hands on her hips and I said, can you lean backwards? And as soon as she did, she said, that really bothers me. It's like, okay, got it. So we went and then she squatted down. And she could get into a pretty good deep squat. And I said, what's going on there? She goes, well, I think it's because I never do this position. So I'm just feeling like, the back of my legs, my cat, your Achilles a little bit. Yep. The inside of my hips a little bit, but it's all just because I'm just doing a movement. It doesn't do anything to my back. Mm-hmm. So it's like, okay, good. So we're good there. So she got on the bed and, we just did some, a couple of things. And I said, so let's check out the stiffness that you feel, coming down through the side of your back and your hip and everything. And, she had she actually was stiffer on the right side than the left side. So that was surprising to her, but it was also very powerful to her because just because you perceive something doesn't actually mean it's true. So she was able to be gently confronted, about her beliefs. Yeah, and that I can't ever do this because it's bad and I'm stiff on this side. Whereas she actually found out that actually I move pretty well on that left side. It's not really stiff. It's easier to move than my right side, but crossing my right leg over my left always feels kind of funny anyway. So that could be part of just kind of how you are. So it was really nice for her she came up with that idea that she was really, she was really kind of like, oh, so what I've been believing all the time isn't really probably true. And I said, well, it's just maybe not what you thought it was. I don't ever want to tell people that, they're telling themselves falsehoods, but I said, maybe it just wasn't what you thought it was. So it was really empowering to her to see that, because she was really, not wanting to do certain things because this back thing was worrying her, and this knot thing was her, really bringing this fear up. And so she was just trying to stay straight and tall in her chair the whole time.
Did you notice that when she was sitting that she had her weight on her right butt, or was she seated? Was she centered in sitting? Did you notice anything different?
She sat over on her right side a little bit.
Yeah.
And she definitely squirmed a lot. She wanted to slump, and as soon as she slumped, she would make herself sit up tall again, which is why I asked her about. I decided we better just get right into sitting right away, because I see all of this going on, and I want to know how much this is playing into what she's thinking here with everything.
I know, because when you cross your right leg over your left, you're really getting you're rolling into the left side bend again, and you would think, you would think she'd want to slump in that position just to open up that left side a bit.
Right.
She went right back into that bad movement pattern.
Right, or to the one that was causing her some issues.
Correct.
So, and it wasn't a stiffness problem. It was more of a, the maybe perhaps the sensitivity around a previously irritated joint.
Right.
That was the issue, and that's what we certainly found with left side bending and backward bending.
Yeah.
The pain became a bit more acute and a bit sharp and more localized, centralized right into the back there. And it's like, okay, this has been going on for 5 months. The likelihood of her having a joint problem is probably null and void at this point.
Yeah.
But she definitely has sensitivity around that movement pattern. Yeah,
exactly. And it's her strategy, and ultimately that's her strategy, and she needs to be aware of it. Awareness is half the battle, as we say.
Yeah.
That's 50%.
And so what she's doing in many ways, even though she has this fear avoidance behavior, she's actually a pain confronter, because she's confronting her pain all the time by trying to make herself sit up and trying to make herself do this, even though it's not comfortable for her. Right?
Because she's been told to sit straight.
Yeah, exactly. So anyway, so just kind of doing a little myth busting was really helpful. And for her to see that it may not be, something that needs to be stretched, that it may just needs to be something that needs to be desensitized.
Right.
I want you to move into like a sitting up tall posture, but not if you're going to get all of these symptoms. Let's work your way into it. Let's find where you can do this without it actually having symptoms, and then be able to kind of start desensitizing that to where you can sit up tall, or you can sit slumped, or you can sit to the side.
Right.
And you're not going to have this experience that you're having now.
Yeah, and I like that word desensitized versus stretching, because people say, I love to stretch and it's not helping. Those are the people that shouldn't be stretching, and we've talked about this many times.
Right.
But the desensitization I like a lot, and that's a big difference. And I think when people get that, like, oh, light bulb moment for a lot of people,
So I had her lay on her tummy, and she just thought, and I said, try doing, kind of like cobra in yoga, only just kind of lift it up as high as you can. Let's see what happens. And it was still very sensitive, like it was in standing, leaning backwards. Yep. So, so that was very telling to me. So now for all of the manual therapists out there, you can think, okay, well, maybe you should do an extension mobilization to, get that joint moving a little bit better. But she was having a lot of sensitivity around it. So I decided to not mobilize her. And I just wanted to give her something that she could do on her own that would change it. So she knew what would make her back worse now. She knew that standing up and leaning backwards, left side bending, or getting off onto the right side of her foot, which was kind of left side bending in her trunk, bothered her. She knew that sitting up straight now was kind of irritable. And then she knows that, that prone kind of push-up thing was bothering her. Yep. So I actually had her lay on her left side. And how you can do a setup in manual therapy for like a flexion mobilization.
Yep.
I just had her bend her knees somewhat, straighten out the bottom leg, let the top leg bend, and bring her, her left arm up underneath her head, so that she was kind of like, and left, in right side bending, which was opening the left side.
Correct.
So basically I was taking her out of compression and allowing her to give her tissues a chance to feel something different.
Like a side lying rotation
Yeah,
position.
exactly. And so we hung there for a few minutes and talked, and we're kind of talking about all the different things and stuff like that. And then I said, now turn over and do the push-up again. So she did, and it felt a little bit better. I said, okay, back on your left side. Let's do it. So you can see now what I'm developing here with her is her test exercises.
Yeah.
Her test movements.
Her reset and her self-checks.
Right. And so now we're giving her some reset things.
Yep.
So bend over is going to be one of them because it feels so darn good. So this left, sideline, thing for, to open up that left side a bit, just to take the tissues out of a little compression because they're sensitive. And she likes it, So then after we did that again, I had her stand up. Oh, she went back on her tummy and did the press up again, and it felt significantly better. Still there, a little pinchy, but definitely not like what it was before.
Yeah.
So then I had her stand up and lean backwards, and she really actually felt fairly good doing it. So we just kind of, made the plan here. It was, when can you, I wanted her to have some things to do. I said, when can you do the bend over? Well, when I stand up from my desk. I said, okay, are you in a place at work where that's okay to do? And she goes, oh yeah, absolutely. Because I could bend over and, do that. And I said, okay, so that would be a good thing to do. I said, what about sitting? What do you think about sitting now? Do you think that, I'm just curious to see how you think your sitting should change. Wanted to see what she would come up with and say. And she needed a little kind of more, well, I know that this, and I said, I know what you've heard. But now what you've seen with yourself, when you sit up really tall, it kind of puts you in a position where that is sensitive. What do you think about that? And she goes, so I don't have to sit so tall. And I said, I love the way that you have moved yourself around on your chair because I think it's important to explore movement. And I said, can you explore that seated position a bit more so that you can find where you can get up taller, but not into the symptoms? Explore the edge of that. So she was into that. She thought that sounded good, so, and I said, because sitting up tall, we need to do that. We need to slump. I said, we have to actually slump down to reach down to our feet to put our shoes on. I mean, all of these motions are important for us to be able to do. So in the short term, when we're hurting, we may avoid them, but that doesn't mean we should never return to them.
Right.
And I think what's happened here with her, I didn't tell her this, but I think what's happened here was her fear was keeping her from exploring those motions and kind of allowing herself to return. And in fact, she was using an old belief that was still continuing to drive her symptoms and her sensitivity.
Yeah, and even though she felt good.
Up straight thing, yeah.
Right, even though she felt good in a slump or forward bend, she was told that wasn't the right thing to do.
Right.
And because she can't at work go on her side and lie in on her side lying left and do that rotational mobilization, she'll get her center of mass straight and forward bend and do whatever. I mean centered and forward bend. And those less is more.
Yeah.
Right.
So we had a little bit more time. So she had that. She's going to do bend over. She was going to do the left sideline thing. And then she told me, she goes, I think I can bring a yoga mat to work and do it at work. And it's like, hey, if you want to, that's fine with me. I wanted her to figure out when she could do it.
Yep.
So then she said, okay, and I said, so we have just a little bit of time. Let's just look at one other movement. So we did the standing twist because we didn't get to it before. And, twisting to the right felt really good. Twisting to the left, there was that little area. Makes sense, right? Because when we go to the left, we're kind of getting a little compression in there, and that sensitivity of that segment or segments, was starting to stop it. And I said, okay, so let's apply everything you've learned here in this session to see if what can we do to get that left twisting better? And she said, well, I can twist to the right. And I said, okay, then do it. So she did it several times. And I said, now twist to the left and see how it is. And it was better. And I said, there you go.
Yeah.
So now she has another test, and actually the same motion, but just going to the opposite side, helped her reset all that.
Totally.
And take some of the sensitivity out. So so now she figured out, but it was fun because she was able to kind of apply what we were doing and come up with their own thing. Because what I want is for her to, like, when she goes to yoga, be more mindful, and even ask for correction and talk, but also not just push herself through things because the class is doing it. You know, I wanted to get her a little bit more power so that she could say, if that bothers me, maybe I need to back out of that movement just a little bit.
Yep.
Knowing that I don't have to avoid it forever, but for right now, I'm desensitizing.
Yes.
So,
and I love the rotation to that's like a 3D reset.
Yeah, right?
To the right. And she can do a few of those in class. And then, it gives the power back to the patient at the end of the day. I mean, that's what you want to do, right?
Yep.
That's fantastic.
Yep. So then I have seen her probably about 3 more times. I think over the course, I'm sorry, 2 more times. And the hip whatever was going on in the left hip joint's totally gone. She's still struggling with the sitting piece and wanting to sit up straight, but she understands where it's coming from now. And she said it's just hard for her to let herself go slump because she's worried her neck is going to start hurting again. And it's like, but I said, just test it. So we talked about testing the movements, and we added some shoulder movements and some head movements and some things. And we talked a little bit about her computer, and I said, you're young, but she goes, well, I try really hard to make sure that I'm not peering at anything. And I said, well, here's some possible solutions. See if any of them sound like something you might want to do. I said, you can either raise the font on your screen to be a little bit bigger. You can move the computer screen towards you just a little bit more, or you can, maybe even you can get a pair of readers, to wear just when you're at your computer so you can see. And it was really funny. And I said, but you may not want to get those readers that you can get from the drugstore. And she goes, why? Because I'll hold my chin up and look down through my glasses. And I said, that if that bothers you, then maybe, you want to get the ones where you can just look dead on. So I said, but you've got choices. You can decide what you want to do and how that's going to feel to you. But anyway, I said, so since you've been doing a little bit more, slumping at work a little bit and taking some breaks out of that big, tall sitting, and I said, have you kind of been paying attention that when that starts to bother you to maybe come out of that, or what have you been doing? And she said that the first thing she does is she just kind of sits back and crosses her legs. Then her left leg over her right. And I said, that's fine with me. I think that's great. And she goes, you don't think I'm just feeding into a pattern? I said, does it hurt? Does it bother you? Are you having issues with it? I said, you're not sitting like that as long as it's not I said, there's really no such thing as a bad posture. I said, the problem is we just get into dominant postures. Yes. And they rule the world. And so I think, I don't want you fidgeting all day in your chair, but I think position changes are great. Yeah. And I think allowing yourself to explore those changes are really, really good. Just kind of like what you're doing. And then we actually did some of her yoga moves. Mm-hmm. Yep. And so, because she was showing me like with one of the warrior positions where she was twisting to the left, how she was trying to figure out to scale it. Yep. So it would feel a little bit better. And she wouldn't be pushing into those symptoms again. So we basically just said, which ones are bothering you? Let's go through them. Right. And, exactly. So I gave her some more clues with, a downward dog using the blocks under her hands. And that seemed to do it because the downward dog itself, like the bend over doesn't hurt, but she was dropping herself into a lot of lumbar extension when she was doing the downward dog. Oh, so wow. That's tough to do. Right, yeah. But I mean, she really was. She has that mobility. Wow. And that bothers her, of course, yep. But she didn't know that that's what was happening. So she was getting all this big spinal extension with downward dog. And so I just basically put the 2 blocks under her hands, and that just actually brought the ground up to her a little bit. And she was able to, kind of mitigate her lumbar positioning to where it didn't feel so bad. Wow. Quick question, Susan. Her shoulder injury and neck issue, was that from sitting? You may have. She doesn't really know. Okay. She doesn't really know. She just said it happened and it turned into a thing. Okay. Got it. Okay. That's okay. I was just wondering why she was holding on to that that she didn't want the knot. It was the knot to turn. Right. There was a knot in her shoulder. I have not heard about the knot since the first time she mentioned it. Okay. Good. which was interesting, because that was the first thing out of her mouth. Yeah. And, when she kind of understood that it wasn't something that needed to be stretched out, that she was just probably over recruiting,
Mm-hmm,
you know,
mm-hmm.
around something that got irritated. 'Cause I said, we get irritated all the time. You know, our body, we're going to have pain. Pain is inevitable. You know, and sometimes we end up with a bigger stress response to it, or sometimes we don't. And it's kind of complex, you know. And so she's got the idea that, you know, that about the worrying about it a little
Yeah,
bit. But,
yeah,
you know, if she wanted to talk about it, I always give people space to bring things up, but I
yeah.
don't keep. If she
Mm-hmm.
comes in the next session and it's not on her, if she's not talking about it, then that's not a priority to her. You
Mm-hmm.
know, they're all going to
Exactly.
talk about what their priorities are, and her
Mm-hmm.
priorities were the sitting at work and, you know, making sure that she wasn't going to get into any kind of other issues before, like she had before, and then kind of exploring some of those things that she was just wanting to try to figure out around her yoga stuff.
Mm-hmm.
And so
Yeah,
now she is back walking to work and
awesome.
walking home from work, very happy.
Good. That's great.
You know, so we're going to take a little bit of a hiatus here and let her work for a few weeks, and then she wants to check back in a few weeks, and
Mm-hmm.
let's see where she is.
Yeah, I think it's interesting that people who, you know, stretching may give people, short-term relief, and I don't even think it gave her short-term relief, but
Didn't help at all, she
it didn't
said.
help at all. Exactly. So
Mhm.
I mean, it's ultimately their strategy, and I think that we as physical therapists really have to focus on the movement. And I know we do, but we need to be very specific in our questions of the patient in terms of what movements, what is meaningful for them, what it, obviously sitting was for her, and really
Mhm.
explore and interview that person in a way that makes sense to them, not just our
Yeah.
standard routine questions. What aggravates? What eases? Do you have imaging? Blah, blah, blah. And I know we need to do that, but we can
Mhm.
figure out a way to get the patient to tell the story and the things that we want to hear.
Mhm.
And, and ultimately just say, we want to give you better options. I mean, I think everybody understands those words, better
Right.
options, right? So, and stretching's not, is not a tool that works. It's something you're doing, and it's a movement strategy, and we're just trying to find a way in. So, and I think that's great. That's
Yeah,
awesome.
I think the other key piece here is that if you really listen to her and her subjective thing and what she wanted out of PT, was she said that she wanted to be shown. She said stretches because she didn't know about other things, but she wanted to be shown ways to be able to get this to calm down.
Good.
She did, you know, so when somebody, so I wanted to do what she expected, and she expected to not. This is what she expected. So,
Mm-hmm.
I know that people get kind of fussy about, well, you could have done manual therapy, and it's like I could have, but we were able to do it without that. And she really only wanted to be shown.
Yeah,
What she really wanted was she wanted to figure out how to do this. How can I get this to stop doing this?
exactly.
And so, it was an immediate asking for me to have for her to, she was asking for her own control.
Exactly.
And she needed to do that. She
Yeah.
wanted to feel like I can take care of this.
Yeah. Yeah.
And she didn't want it to turn into a big thing where she had to go to somebody. And this is, I think, the issue probably that's still maybe hanging out with her neck. And we'll see the next time she comes in. But I think that that the deal is that she felt like somebody had to get her out of her neck problem, that she didn't get herself out of her neck problem. And when
Mm,
her back started, she was worried, like she said, she was worried to
to
death it was going
death.
to turn into this neck thing.
Mm-hmm.
And, so if I had kind of maybe, I mean, who knows what would have happened if I had changed the therapeutic alliance a little bit and kind of been the fixer, like the
Mm-hmm.
hands-on fixer.
Mm-hmm.
I don't know. So that's why I just, I just went with it.
Well, I think that if you did, because she made it pretty clear she wanted to do
Mm-hmm.
things on her own, and a lot of patients do, but they don't tell you that.
Right.
Um, and but if someone's that age, she's young, and
Mm-hmm.
I probably would have done something, very similar, to be honest. I
Yeah.
mean, would I have gone in and assessed her lumbar spine? I'm sure you did. Yeah,
Mm-hmm.
yeah, but
Yeah,
when
I
people
told you the highlights of what I
yeah,
found.
exactly,
Mm-hmm.
exactly. So, I think that if we can find ways in the first visit to give them something to do to get them out of their symptoms, they're going to come back.
Yeah.
And if you want to do any manual work after that, then go for it.
Yeah.
I mean, but I think that just giving people strategies and just empowering them, you know. And I ask patients a lot lately and this really helps, instead of, I mean, I know how old they are, but I'm like, how old do you feel? And it's never their own age.
Yeah.
Ever. Ever. And you'll see here 90, you'll hear 50, you'll hear 60. I think that for me is telling. And you want to debunk that. You know, you have the first session, you want to debunk all those myths, and that's what you did. And it's fantastic.
She was a resilient person that was
totally
already doing the right things to make changes for herself, and
yep,
just needed a few tweaks.
Yep.
So, yep.
Cool.
All right, everybody. Thanks for listening.
Thanks, guys. And we're going to put on our website, we're going to put a lot of podcasts together that have similar themes. So if we talk about a hip or a lumbar spine, so we'll put them in groups on the site so you can access different podcasts that have
listen to different ones.
Listen to different ones, exactly, that have a similar theme. I re-listen to a lot of them because I learn something new every time I listen to them. Seriously, there's something very different about doing and speaking and then listening, right?
Exactly.
And so we're going to put that together going forward. So, and if you haven't left a testimonial on iTunes for us, we would really appreciate it. Please to do so. We're trying to get up into our, we need to get like 20 more reviews. So we have a lot of good reviews, but you know what? We always would love more. So please do that.
It helps people find us. Thank you.
Exactly.
Okay.
Bye.
Until next time.
Until next time.